Hi, Dr. Eric Thomas for Nutmeg Dermatology, visiting you again and talking this time about Lyme disease. Now that's a topic that goes way beyond dermatology. We frequently diagnose it, but I'm not going to talk about certain controversies, the way it's treated, long-standing conditions. All of those are very serious issues, but best handled elsewhere. I'm just going to tell you a few anecdotes, especially since my practice is just across the Connecticut River from Lyme, Connecticut. I think the first spot I saw was an individual who had something basically a circle roughly that size with a cleared center. Really characteristic, but we barely knew what it was way back then. Since then, I've seen many people with Lyme disease, and a lot of the people around here are very knowledgeable about it, having had it 2 or 3 times. As you may know though, for backgrounders, they're small little ticks. They're roughly the size of the head of a pin. You can see them. Some people have seen them, but they're certainly not the big dog ticks that you're more used to. They live on certain types of mice, and deer carry them. Be careful in the woods. Check yourself afterwards, although you won't see these guys. But, wear good clothing, perhaps tuck your pants into the socks and so forth if that's what you're wearing. Use a repellent if that floats your boat and you're willing to put a chemical on your skin. But in any event, regardless of all that, there are things to watch for. Not everyone, but a fair number of people do develop a red, basically not itchy, burning rash. It can be one. It can last a few weeks or a month, and then it will fade, so it's not going to be there forever. The center traditionally is cleared, but I've seen many that are red from edge to edge. There is a blood test. The blood test is not perfect, but it certainly should be done. Here's an important thing though. The blood test relies on your body producing a reaction to the bacteria that produces Lyme disease. The ticks are infected with a bacteria that in this neck of the woods is called Borrelia burgdorferi. Don't have to remember that. But I understand there in other parts of the country, other ones, I believe in the upper Midwest, there's a Borrelia mayonii named after the Mayo Clinic, as far as I know. So that's why the blood test is good, should be done, but you really have to wait 3 to 4 weeks after the bite or the rash shows, because if you do it too soon, your body will not have produced the antibodies that the test looks for. In any event, if I'm really suspicious, even though we may order the blood test, we'll just go ahead and treat people. And regimens vary, but as you may know, the traditional is a tetracycline called doxycycline, 100 milligrams. Used to be for 10 days, but way back in the day, they increased it to 21 days. Why treat Lyme disease? Well, it doesn't have to, there's genetic predisposition. It can stimulate your body's immune system to react in such a way that you have long-lasting fatigue, tiredness, neurological change. You could have a droopy eyelid, like you've had a mini stroke. It's not a stroke, but it can do that. And of course, arthritis. And we have had people in the Connecticut Valley area, a lovely area, by the way, that should come visit it. We have had people who have wound up in wheelchairs and been quite disabled by chronic Lyme disease. Just to make your day complete, there are certain other conditions that ticks can produce. There's ehrlichiosis, there's babesiosis, and these are no fun either. Some people are said to have the trifecta of all three. I was biking in Europe many years ago, got really tired. Turned out I was down a pint or a unit or two of blood, diagnosed when I got back, but it was babesiosis, and that's not a long-standing problem, but I did lose a week of work and had to take a couple of antibiotics to knock them out of my blood system. Babesiosis is more of a parasite of red blood cells. It's a little, in my opinion, having experienced it, like a malaria with shaking chills. So there's a quick run through of tick-borne illnesses in the, well, not only in Connecticut, not only in Lyme, Connecticut, but in other parts of the country, because as you know, it's been spreading. Trying to educate you and trying to answer your questions. Thanks for listening. Eric Thomas, Nutmeg Dermatology. Take care.